Good day, everyone. I am Ophel Gantuangco, a medical resident from Asian Hospital and Medical Center, and I'm here to present a case report on a primitive neuroectodermal tumor of the spine in a 64-year-old male successfully treated with surgery, craniospinal radiotherapy, and concurrent chemotherapy. Primitive neuroectodermal tumors are a group of malignant neoplasms arising from pluripotent neural crest cells. They are classified as either central or peripheral. Among peripheral pinets, a primary spinal location is considered rare and limited to case reports, with over 100 cases reported since its discovery. Among the spinal pinets, 33% are located in the thoracic region. In a study on the primary tumors of the spine by Engelhard in 2010, only 1% represent pinets, and among primary intraspinal pinets, 66% are males, 49% are adults, and in this 49%, only 2% are elderly, with the average age occurring in the second decade of life. This table shows the summary of cases of primary spinal pinets in the elderly reported in the literature. This case makes the fourth case of spinal pinet in the elderly so far to the best of our knowledge. This is the case of a 64-year-old Filipino male who presented with a 2-month history of bilateral progressive lower extremity weakness and numbness. This was associated with urinary and bowel incontinence and a sudden shooting pain on the lower back radiating to both lower extremities. A plain MRI of the spine was done and showed an intradural lesion with extradural component at the right T9-T10 level measuring 7 by 2 by 3 centimeters, causing mild to moderate cord compression and subsequently causing the patient's symptoms. The patient underwent laminectomy with gross total excision of the tumor and submitted for histopathology. Thereafter, the patient felt improvement on his motor strength and sensation. Biopsy findings revealed a small round cell tumor with a highly vascular stroma and pseudorosette formation by tumor cells. Immunohistochemistry staining was done and was found to be positive for synaptophysin, which is a broad-spectrum neuroendocrine marker, and CD99, which is highly specific for PNET. The final histopathologic diagnosis was a spinal peripheral primitive neuroectodermal tumor. Studies showed that radiotherapy and chemotherapy is associated with improved 1 and 2-year survival rates. Thus, the patient was advised for adjuvant treatment but was lost to follow-up. PNET is a highly aggressive cancer and has a post-operative recurrence rate of 90%. In October 2017, 3 months after his surgery, the patient felt progressive weakness of his lower extremities. A repeat MRI of the spine was done, and a recurrence of the mass was noted, causing mild to moderate cord compression. The patient was then referred for re-excision but opted to undergo radiotherapy concurrent with chemotherapy. Pinets are characterized by their radiosensitivity and chemosensitivity. In the adult setting, a standard dose of 35 to 36 gray to the craniospinal axis is recommended. In our patient, he received 36 gray in 20 fractions and an additional 18 gray in 10 fractions to boost the residual tumor at T9, T10. According to the adult PNET guidelines, there is currently no randomized data available supporting the routine use of adjuvant or neoadjuvant chemotherapy in adult patients with primary PNETs. Nevertheless, recently published contemporary studies have reported higher survival rates than as commonly reported on retrospective series using radiotherapy only. Thus, our patient underwent concurrent chemotherapy with cisplatin, vincristine, and cyclophosphamide as recommended by the adult PNET guidelines, but was dose reduced because of the patient's age and functional status. During his treatment, the patient developed severe weakness and dehydration attributed to chemotherapy side effects, causing treatment interruption for 1 week, but was able to complete therapy thereafter without difficulty. In April 2018, the patient underwent repeat MRI which showed laminectomy changes in T9, T10 with no evidence of tumor recurrence. PNET is a highly aggressive cancer and has a post-operative recurrence rate of 90% without the benefit of radiotherapy and chemotherapy. just like what happened in our patient. And because of the aggressiveness of these tumors, the prognosis remains poor, with the disease-free survival rate being 45% at 7 years. At present, our patient recently underwent a repeat MRI and still with no evidence of tumor recurrence. He is now undergoing physical therapy to improve his muscle strength. In conclusion, primary spinal pinette is a rare condition that can present with acute neurologic deficits. The treatment is based on pinettes found on the CNS and in children. Despite its radiosensitivity and chemosensitivity, the prognosis is still poor and there are no current recommendations or guidelines regarding its management and surveillance, which would be a good topic for prospective clinical trials. A research on its molecular pathogenesis can also be helpful to identify potential molecular therapeutic targets in the future. Here are my references. Thank you for your kind attention.